Hello, my name is Heidi Signor and I'm the director of our primary care division. I'd like to share with you the story of our evolution into a primary care division. For those of you new to Coordinated Health, this evolution has been many years in the making. As we've grown over the past decade, the need to develop the services we offer to our patients has grown. Like everything else we do, the patient experience is always a central theme in developing these services. We ask ourselves, how can we better meet the needs of our patients and how can we better serve our communities? In 2005, with those questions in mind, we identified a need for a dedicated department to handle the volume of workers' compensation claims, drug screens, and work-related physical exams. This program was strictly occupational medicine and the employer health services. We called it WorkCares. In 2007, after seeing patient volume and service needs grow, Care on Call was introduced to all surgical patients. Care on Call was essentially a hotline patients could call 24/7 with postoperative concerns or questions. The introduction of Care on Call hotline allowed us to more effectively use our staff at the Coordinated Health Hospital in Bethlehem and offer our surgical patients a better patient experience. Calls to the hotline were answered at night by our hospital nurses and our nighttime physicians. Patients were able to call the hotline with questions or concerns, and if a patient required immediate attention, they were directed to come to our hospital for an evaluation. In 2008, we decided to hire our first primary care physicians. Why? Well, at this point in our evolution, we felt that staffing WorkCares with primary care physicians would allow us to expand the depths of services we offered to our existing patients, as well as our new patients. Now, not only could patients see a WorkCares physician for workers' compensation or work physicals, but they could also establish themselves with a Coordinated Health primary care physician. Primary care services allowed us the ability to establish a greater continuum of patient care and further integrate all CH specialties and services. The new WorkCares physicians also transitioned to taking care of all of our hospital inpatients. Around this time, I took over the WorkCares department. It quickly became apparent to us that having the WorkCares physicians at our campus on Shanersville Road and our hospital patients at our campus on Highland Avenue was not an ideal situation for the patients and the physicians. After all, you can't adequately monitor patients in a hospital when your physicians are on a different campus. As a result, we moved the WorkCares department to our hospital campus on Highland Avenue in Bethlehem. A couple of things happened to expand the WorkCares department after the move to our Bethlehem Hospital campus. First, more primary care physicians were hired to staff additional WorkCares locations in East Stroudsburg and our hospital campus in Allentown. Second, all WorkCares physicians began developing a primary care practice. And third, we merged the Care on Call hotline with WorkCares. Now all our patients, not just surgical, could access the hotline, and all our employers could send their injured workers 24/7 to our Care on Call locations. In 2010, we decided to eliminate the confusion of using two different names, WorkCares and Care on Call, to describe the same department, physicians, and services. We chose to use the Care on Call because we needed a name that would first appeal to primary care patients and help them better identify the types of services they were receiving. A patient with hypertension going to WorkCares for treatment, it just doesn't make sense. Second, appeal to our contracted employers. And third, be marketable to all of our patients and let them know about our primary care and our after-hours program. Of course, as Coordinated Health's growth continued, so did our need to expand the services we offered to patients. So in early 2011, we decided to eliminate the barrier of call-in and appointment access only to these physicians and services and offer the patients the ability to simply walk in and receive care. We wanted to use a recognizable name so patients would instantly recognize the new level of service we were offering and distinguish us from all other walk-in facilities. And of course, we had to make it about the patients. We live in an accessible world where information, services, and entertainment are all available at a moment's notice, whenever we want them. So why not healthcare too? What could be more about our patients than an on-demand healthcare service? So our Care on Demand service was born. So now you understand how our primary care division came into existence. But what is its purpose now? Well, our primary care division has 4 distinct types of services. all of which have a unique effect on our patient experience. The first is primary care service. This is our continuity patients. These are patients with chronic medical conditions that are followed closely by our primary care physicians. Of course, we have our care on demand service. This is for patients that need us immediately. They need us for sick visits or an injury. They can walk in and receive care without an appointment at any 4 of our care on demand facilities. Care on Call is now our hotline that is able to help us serve our care on demand patients. Patients can call in and speak to a doctor 24 hours a day, 7 days a week. The third is our workers' compensation and employer health services. This is the foundation of our primary care division. We currently take care of over 1,200 regional employers, treating sick visits, physicals, vaccinations, testing, and lab work. And the last component is our hospital inpatient care for all of our inpatients at both our Allentown and Bethlehem Hospital. Coordinated health surgeons and our primary care physicians, they work hand in hand to monitor and manage the medical conditions of patients while they're under our care recovering from their surgeries. As a coordinated health employee, you already know all of the great benefits of the Care on Demand service, like quick access and extended hours. Care on Demand service is available to you, your family members, your friends, and most importantly, our patients. As you interact with our patients every day, please remember to tell them about the Care on Demand services. It's a service that everyone can benefit from. Let's meet our primary care physicians.
Hi, I'm Dr. Ryan Smith. I'm a primary care physician at Coordinated Health. I practice primary care medicine here at our Highland Avenue facility. I specifically chose a career in family medicine, again, because I like the challenge of taking care of a wide breadth of patient problems. I enjoy seeing patients at the entry point into the healthcare system. I also have the opportunity to take care of patients from a lot of our local employers that we take care of and provide occupational health services for. And lastly, I'm able to work in the inpatient setting and as a hospitalist and take care of hospitalized patients who have just had surgery. So it's a really unique career experience for me. I'm originally from the town of Bangor here in the Lehigh Valley, and I take great pride in taking care of and treating patients from the area from which I came.
I'm Barry Serrard. I'm a primary care sports medicine doctor. I see everything from sports injuries to urgent care to family medicine. I got into family medicine inadvertently. I thought I wanted to do something else and found family medicine and really enjoyed that, and then ultimately found sports medicine, which is my love. I started swimming when I was 4 years old and swam competitively all the way until 18. When I was about 15, I started doing triathlons, and I raced on the national team and competed in 2 world championships. Later, when I was in my late 20s, I started racing professionally. While I am a primary care sports medicine doctor, part of that, being that type of doctor, is primary care, which means family medicine. And having 5 children and a wife, I've had lots of practice with my family. I've just recently become one of the team physicians for Lehigh University. For the fall season, I'll be covering men's and women's soccer, and the spring season, I'll be covering men's and women's lacrosse.
Hi, I'm Seth Berkey, and I'm one of the Care on Demand physicians working at Coordinated Health. I currently work in the East Stroudsburg and Broadheadsville offices. I grew up playing all types of kinds of sports and wanted to be around the athlete, the young athlete, the type of patients that want to get better if they're hurt. Here in the East Stroudsburg office, we see a variety of patients for a variety of illnesses and disease process and injuries as well. A lot of these patients may not have the time or the resources to go somewhere else, and they like coming to Coordinated Health. They're able to get in right away, same day, and be seen by a physician. So we do see a variety of injuries and serious injuries. I really feel as though our new Care on Demand walk-in facility across the street will be of value to the patients in this area. They'll be able to be provided rapid care in a timely manner. And it's a facility with doctors and extenders that will be able to provide great care for all types of illnesses and injuries.
My name is Dr. Zlotnick. better known as Dr. Z, Jeffrey A. Zlotnick, MD, CAQ, FAAFP, lots of initials after the name. I'm family practice sports medicine with Coordinated Health. I'm at the Lee Heighton office. I'm also at Allentown, Bethlehem Emmerich Boulevard, and Phillipsburg. So we'd like to know how I got into this. Sort of goes back, I hate to say this, to third grade. My handwriting was so bad, she actually looked at it and says, "You're going to be a doctor." And I just sort of planted the idea in my head. Got into family medicine because I was in medical school in New Jersey Med in Newark. I was looking at various rotations, and a friend of mine put me wise to this radical idea called family practice, where you treat the person. It's not just the disease that you're treating the whole person, and the bug was planted at that point. I knew what I wanted to do. And the other question would be what got me into sports medicine. Well, I'll give you guys a very good safety tip. Do not try to learn how to ski in your 30s. A pretty bad ski accident tore my knee apart. When I was in medical school, I ended up getting surgery on it. Started working on that with rehab, and it got me an interest in doing this sort of approach to sports medicine. So, very much fell in love with that approach to medicine, and I haven't looked back since.
My name is Dr. Art Hoffman, MD. I've been in Allentown for the last 30-some years. I'm now at the Coordinated Health Campus in Allentown, practicing internal medicine. Glad to be here and glad to be seeing my patients that I've accumulated over the last 30 years, as well as new patients who are looking for an internist to care for them. I take care of routine problems as well as complex problems. I see patients in my office. I also have a hospital practice and in addition, see patients as a hospitalist at the Coordinated Health location at Cedar Crest Boulevard in Allentown. I chose internal medicine because I enjoy taking care of the whole patient. I enjoy taking care of adults, and I like being a diagnostician as well as taking care of complex medical problems. I think that that's what medicine's about, is like helping people and advocating for people, and that we do work for the patient, even though we have all these other things that are distracting us in medicine. We ultimately work for the patient.
My name is Dale Bautista. I see patients here at Allentown in the primary care division. I do hospitalist type work, inpatient. I see patients at our Care on Demand division, which includes seeing patients for any type of injuries, whether it be sports, musculoskeletal, urgent care type stuff. I also do a lot of employer health. One of my strengths with what I feel is in my patient care is communication. Not everyone's a medical professional, not everyone knows terminology, and I tend to simplify things, and I take extra time to sort of educate the person on what their disability is and how we can get it better. I think that is part of the practice and part of the fear of patients, is that they don't want a physician who's going to tell them exactly what has to be done in a language that they don't really understand. And so when you come into my office or any of the offices here, you'll sort of get that sense that, okay, these guys, they know what they're doing and they know how to tell me what needs to be done. In addition to that, the patient experience here at Coordinated Health, it's almost one-stop shopping. So patients like to know that their care is being done in a timely manner. When they are waiting on a study, they don't want to wait 6 weeks before they find out what's wrong with them. People like to know what's wrong and how fast they can get better. And that's one of the things that our strengths are. That's one of our strengths here at Coordinated Health, is just that our urgency of care is top-notch, and we get people better fast.